Hi everyone, welcome back to another installment of New Beauty Talks. I'm features editor Tatiana Bido, and today we're talking to leading double board certified facial plastic surgeon, Dr. Konstantin from New York, and he's here to talk to us about a very important topic, which is facial feminization surgery. It's a topic we've wanted to cover for a really long time, and I can't think of a better time than now during Pride Month to really talk about it and discuss what options are out there for patients. So thank you, Dr. Konstantin, for joining us.
Always my pleasure. Thank you for your kind introduction.
So let's get started. What is facial feminization surgery, and is it always surgery?
It is not always surgery, and there is actually no designated procedure that we say this is for facial feminization and this is for everybody else. Facial feminization is a set of procedures that we normally do for all other people, men and women alike, but we put them together in one package, so we make somebody's face appear softer, appear more feminine.
So who is the best candidate for this? Is this really for the trans community, or is this for anyone who wants to feminize their features or soften their features?
The facial feminization procedures are not just for the trans community. We have quite a few male patients who come in and say, look, I really don't like this rugged, over masculine appearance. I don't feel like it reflects my true personality. So I want to soften my features because I believe this is who I am. And we can use the same procedures in this situation.
And before we go into which procedures fall under this umbrella, what is the end goal? Like, what areas of the face are you looking at, and what are you doing to each area? Is it all softening, or?
Male and female faces scientifically have a different phenotype. There's certain features that are different in males than in females. And of course, there's a very significant overlap between the two. So in facial feminization, we can change the defining features of the face that would tell somebody who's looking at the picture or the real person whether this is a male or a female.
What areas of the face in particular are patients coming in for, and what are you typically doing to tweak those areas?
Thank you. It's a very important question. When we are doing facial feminization procedure, there is really not one area that we should concentrate on. Okay. So there are several areas around the face that we can feminize, and doing them all together is very important in creating this more feminine appearance.
In terms of what your patients are coming in for, let's talk about the face in thirds. Up here in the upper part of the face, in the eyes, what procedures are they pursuing, and what is the look that they want? How do they want to change their features?
Right. So when we look at the upper third of the face and we're looking to feminize this area, we start with a hairline because very few people realize that men and women hairline is different. Male hairline has more of an M-shaped appearance, and a female has a straighter hairline. So hair transplant is usually the way to go when we need to take care of this area. Now, the forehead is also different. Male forehead is typically longer, and it is more sloped. In a female, the forehead is more straight. And male forehead has a lot of irregularities, have a lot of bony prominences. So all those things factor into a feminization procedure strategy. Now, when looking at the eyes, well, of course, we have to look at the eyebrows first as a frame of the eyes. So female brows are more arched, and they generally higher than the male brow. When we look at the eyes themselves, the male eyes appear to be a little bit more deeply set and smaller. So when we're looking at feminization surgery, we have to take this into account and offer patient a procedure that will change those areas.
So what are those procedures? So we talked about hair restoration. So
right.
For the brow and the eyebrows, what procedures do you perform?
So there's surgical and non-surgical procedures that we can utilize to feminize the upper third of the face. Non-surgical procedures would be fillers, right? And this is the easiest way to make the forehead look more rounded and look smoother and hide all those bony prominences and irregularities. Of course, using Botox is very important because oftentimes the facial mimetic muscles are much stronger in males, so softening them up definitely helps. As far as the area around the eyes is concerned, we do a procedure like blepharoplasty. When we can remove the hooding and get rid of the bags under the eyes, make the eyes appear larger. And brow lift, of course, is another procedure that we can use, another surgical procedure when we can lift the brows and change the shape of the brows to make it appear more feminine.
What about the nose area? Is there a difference between a female nose and a male nose? And what are your patients typically wanting to come in and do in that area?
Rhinoplasty is a very common part of facial feminization because our noses are slightly different. Male nose typically bigger, heavier, has thicker skin, but there are other key features that we definitely can change. The female nose is more upturned. We call it rotated in medical terms. And male nose is typically the nasal tip rotated much lower than a female nasal tip. Also, male have this deep set nasofrontal angle and more prominent bone around the forehead, around the glabella. And also typically we associate dorsal hump or longer nose with a male phenotype.
So it's a lot of refinement up here, and then the tip is super important, right?
The tip is very important because the cartilages are usually smaller in females, so we need to reduce the cartilages and thin the tip in order for it to appear more feminine.
What about non-surgical nose jobs?
Non-surgical nose jobs also could help. Of course, everyone is different,
Right.
but we can use the fillers around the nose to create more feminine appearance.
And then what about the lower third of the face, the lips, the chin, and the jawline, which is getting a lot of, it's like a trending area right now.
Right.
But for this particular surgery, I would assume that having that like heart-shaped face is the end goal, right?
Yes, that's the lower part of the face cannot be underestimated. Well, let's start with the lips because this is a very, very big defining feature. So typically female lips are larger, they are fuller, and they are more defined. The cupid's bone and the edges of the lip are more refined, more prominent, and lip filler is very important part of facial feminization. Now, you also mentioned the heart shape of the face. So of course we do the cheekbones, right? So always something that we have to address because male cheeks are typically flatter and the face is a little wider. So for facial feminization, we need to change that balance. And then jawline softening and making the chin look a little more pointy would go a long way to soften and feminize somebody's face.
So it's all, pieces and parts of a puzzle, because you think of the chin as being, having a prominent chin is a very male feature, but for women, it's also really important because it's all about bringing balance, right?
Yes, absolutely. So the chin, changing the contour of the chin is very important. Softening up the jawline and redistributing the balance of the face from the lower part with more prominent masseters and prominent chin to the upper part of the face, creating more prominent cheeks. This is one of the strategies that we use.
And is it always all surgical when you're reshaping the lower part of the face, or are you mainly doing non-surgical treatments?
A lot of this work is non-surgical. We can
Okay.
use fillers or we can use permanent fillers like fat grafting to change the balance of the face and soften up the jawline.
What about skin texture? How does laser skin resurfacing play a part in facial feminization surgeries?
Well, facial feminization surgery really involves improving the texture of the skin and reducing pore size, and we really getting rid of a lot of blemishes around the face. blood vessels that appear prominent, sunspots. Laser is not quite the part of surgery, I should say, but this is the part of this whole facial feminization strategy that we employ. So really skin resurfacing and laser as a part of skin resurfacing cannot be underestimated here.
So it's an entire treatment plan. It's not just one thing or another thing. It's what's good for the patient, and it involves a combination approach, right?
It is very important for us to have a strategy. People really have to have a very clear plan in mind, what they're going to start with, what's going to be the next procedure, and what is possible to achieve with all those procedures put together. So we usually have a long discussion with the patients before we start this process of facial feminization, just to make sure that we have similar aesthetic goals and we're all on the same page.
So Dr. Konstantin, how have these procedures evolved? When you think about facial feminization surgery, you think about maybe like in the 80s or early 90s, where it was just a very invasive procedure or procedures. How has it changed, and what are the non-surgical options that people can have now?
Non-surgical options for facial feminization strategy is a real game changer, because we have so many tools now in our toolbox that allow us to achieve a completely different aesthetic outcome that we could do in the past with surgery alone. So a lot of things like fillers, Botox, skin resurfacing help us to achieve our goals much better in many cases than we used to do with shaving the bone and doing a lot of those very invasive surgeries.
So Dr. Konstantin, for patients who have been considering facial feminization surgery and maybe they're on the fence, what is the very first step that they should take?
I believe that this should be approached really gradually. Facial feminization should not be a one-time deal when somebody gets everything and starts with the big surgical procedures. We want to make sure that we're doing the right thing for the patient, and we want to make sure that we're meeting all the aesthetic goals of the patients. So I typically advise people to start with smaller procedures that are reversible and temporary. Once people realize that this is exactly what they want and this is exactly how they want their face to look, then we can make this transformation permanent with some surgical procedures that are designed for that.
So if someone is looking into it and they're ready to take the first step, how should they research the proper surgeon or doctor? Especially since there doesn't seem to be so much information online or before and after pictures. How does someone go about finding the right doctor for them?
This is a very interesting question. Really, very few doctors go out there and say that I am a facial feminization specialist. Maybe really they should be more of that now. But a good way to start is to find a plastic surgeon whose aesthetics aligns with your sense of aesthetics, right? And nowadays, it's so much easier to do than in the old days. You don't have to go on the phone and call the offices and make multiple appointments. Just go on the internet, go on doctor's website, find their pictures. If you like what you see, if you like those before and after transformations that virtually every plastic surgeon posts on their websites now, then you can trust this doctor to help you. And then, of course, calling the office, setting up an appointment, and having a frank conversation with the doctor about your needs. This would be a very important second step.
Well, thank you so much for joining us, Dr. Konstantin. I think this is a really important topic for NewBeauty to spotlight, especially this month during Pride Month. And I thank you very much for the work that you're doing with a lot of the members of the trans community and whoever wants to have facial feminization surgery. I think you should trademark facial feminization strategy, because I think that's a better term. But we've learned a lot, and I want to thank you and have a wonderful day.
Thank you, Tatiana. My pleasure being here.
Until next time.